Hi, I'm Dr. Rubino. I'm an orthopedic surgeon in Dayton, Ohio. Aerobiotix is a local company that I learned about a number of years ago. There was a landmark study done in our community about 10 years ago looking at airborne contamination in the operating room. We found a time-dependent variable, that is, more time went by, more people came into the room, more bacterial particles were there, and more of these sets got contaminated. So since that time, we've been looking at ways that we can reduce the potential risk of getting an infection in the operating room. We want that rate to be zero. The Aerobiotix machine has the ability to clean air as a real-time process, so the air that is contaminated in the operating room can be cleaned during the operation in a non-turbulent way, and that potentially can reduce the risk of a surgical infection. We've been using the Aerobiotix machine for the past 2 years in our operating rooms. And what we found is that there is a decrease in the infections. The infection rate was low. We want it to be zero, and the Aerobiotix machine is helping us get to that number. The Aerobiotix machine in the room has done a lot of good things for our staff. From the standpoint of safety, that's airborne contaminants. From the standpoint of the electric cautery smoke, that's a big concern for the safety of the staff. And now with the onset of the coronavirus, the concern of airborne particles and the potential negative effects they can have both on patients and staff is first and foremost on all of our minds. And using the machine in the room does help to alleviate a lot of the concerns about developing illness from being in the operating room. So as we've resumed elective surgeries in our system, what we found is the staff is much more comfortable knowing that the machine's in the room running real time and removing airborne particles, including viral particles, from the air and making a cleaner and safer environment for the staff. The Aerobiotix machine is part of our infection control protocol. We've been very happy with the machine. We've been very happy with the results. We plan on continuing this as part of our infection control protocol.